1. A pediatrician prescribes an intravenous, IV, solution of 5% dextrose and half normal saline, 0.45%, with 40 MEq of potassium chloride for a child with hypotonic dehydration. The nurse performs which priority assessment before administering this IV prescription? 1. Obtains a weight 2. Takes the temperature 3. Takes the blood pressure 4. Checks the amount of urine output. Answer. 4. Checks the amount of urine output. Rationale. In hypotonic dehydration, electrolyte loss exceeds water loss. The priority assessment before administering potassium chloride intravenously would be to assess the status of the urine output. Potassium chloride should never be administered in the presence of oliguria or anuria. If the urine output is less than 1 to 2 milliliters per kilogram per hour, potassium chloride should not be administered. Although options 1, 2, and 3 are appropriate assessments for a child with dehydration, these assessments are not related specifically to the IV administration of potassium chloride. 2. A client with medullary carcinoma of the thyroid has an excess function of the C cells of the thyroid gland. When reviewing the most recent laboratory results, the nurse should expect which electrolyte abnormality? 1. Sodium 2, calcium 3, potassium 4, magnesium. Answer. 2. Calcium. Rationale. The C cells of the thyroid gland are helpful in maintaining normal plasma calcium levels. They do not affect the levels of sodium, potassium, or magnesium. 3. Colchicine is prescribed for a client with a diagnosis of gout. The nurse reviews the client's record, knowing that this medication would be used with caution in which disorder? 1. Myxedema 2. Kidney disease 3. Hypothyroidism 4. Diabetes mellitus. Answer. 2. Kidney disease. Rationale. Colchicine is used with caution in older clients, debilitated clients, and clients with cardiac, kidney, or gastrointestinal disease. The disorders in options 1, 3, and 4 are not concerns with administration of this medication. 4. Hydrochlorothiazide has been prescribed for a client with hypertension. The nurse contacts the primary healthcare provider, PHCP, to verify the prescription if which condition is noted in the assessment data. 1. Hypertension 2. Allergy to eggs 3. Nephrotic syndrome 4. Allergy to sulfonamides. Answer. 4. Allergy to sulfonamides. Rationale. Hydrochlorothiazide is a diuretic and antihypertensive medication that is used to treat mild to moderate hypertension, edema associated with heart failure, and nephrotic syndrome. The medication is a sulfonamide derivative. A contraindication to the use of this medication is a history of hypersensitivity to sulfonamides. The conditions noted in the remaining options are not contraindications for the use of this medication. 5. An adolescent has been prescribed an amphetamine to help manage a diagnosis of attention-deficient hyperactivity disorder. To best minimize the risk of abuse and/or overdose, the nurse expects that the medication will be administered via which method? 1. Sublingual tablets 2. Transdermal patch 3. Rectal suppository 4. Weekly intramuscular injections. Answer. 2. Transdermal patch. Rationale. The application of an transdermal patch is the method best suited to minimizing the risk of abuse and/or overdose from an amphetamine because it manages the release of the medication without requiring the client's handling of the medication. The remaining options lack that component. 6. A home health nurse visits a client who suffered a back injury. On reviewing the primary healthcare provider's prescriptions, The nurse notes that codeine sulfate has been prescribed for the client, and the nurse provides instructions to the client regarding the medication. Which statement, if made by the client, indicates an understanding of health measures related to the medication? 1. The medication is not addicting. 2. I should watch out for diarrhea as a side effect. 3. I should increase my fluid intake while taking this medication. 4. I need to be sure to eat foods that are low in fiber to prevent diarrhea. Answer. 3. I should increase my fluid intake while taking this medication. Rationale. Codeine sulfate is an opioid analgesic used to treat pain and can cause constipation. Because it is an opioid analgesic, codeine sulfate can be addicting. The client is instructed to increase fluid intake to prevent constipation. The client also should consume foods high in fiber and should take a stool softener. 7. The clinic nurse is performing an admission assessment on a client and notes that the client is taking azelaic acid to treat acne. The nurse determines that which client complaint may be associated with use of this medication. 1. Itching. 2. Euphoria. 3. Drowsiness. 4. Frequent urination. Answer. 1. Itching. Rationale. Azelaic acid is a topical medication used to treat mild to moderate acne. Adverse effects include burning, itching, stinging, redness of the skin, and hypopigmentation of the skin in clients with a dark complexion. The effects noted in the other options are not specifically associated with this medication. 8. A client who has a cold is seen in the emergency department with an inability to void. Because the client has a history of benign prostatic hyperplasia, the nurse determines that the client should be questioned about the use of which medication. 1. Diuretics. 2. Antibiotics. 3. Antilipemics. 4. Decongestants. Answer. 4. Decongestants. Rationale. In the client with benign prostatic hyperplasia, episodes of urinary retention can be triggered by certain medications, such as decongestants, anticholinergics, and antidepressants. These medications lessen the voluntary ability to contract the bladder. The client should be questioned about the use of these medications if he has urinary retention. Diuretics increase urine output. Antibiotics and antilipemics do not affect ability to urinate. 9. A client is receiving ganciclovir. Which nursing action is appropriate during the time the client is receiving this medication? 1. Monitoring blood glucose levels for elevation. 2. Administering the medication on an empty stomach only. 3. Applying pressure to venipuncture sites for at least 1 minute. 4. Providing the client with a soft toothbrush and an electric razor. Answer. 4. Providing the client with a soft toothbrush and an electric razor. Rationale. Ganciclovir is an antiviral medication. Common adverse effects of ganciclovir are neutropenia and thrombocytopenia. For this reason, the nurse implements the same precautions that are used for a client receiving anticoagulant therapy. These include providing a soft toothbrush and an electric razor to minimize risk of trauma that could result in bleeding. The medication may cause hypoglycemia, but not hyperglycemia. The medication does not have to be taken on an empty stomach. Pressure on venipuncture sites should be held for approximately 10 minutes. 10. A client diagnosed with schizophrenia has a new prescription for risperidone. Which baseline laboratory results should the nurse review before administering the first dose of this medication? 1. Platelet count. 2. Blood clotting tests. 3. Liver function studies. 4. Complete blood count. Answer. 3. Liver function studies. Rationale. Risperidone is an atypical antipsychotic. A baseline assessment of renal and liver function should be done before the initiation of therapy with risperidone. The medication is used with caution in clients with renal or hepatic impairment, in those with underlying cardiovascular disorders, and in geriatric or debilitated clients. These clients are started on the medication at a reduced dosage level. None of the other diagnostics are relevant to this medication. 11. A client gives the home health nurse a bottle of clomipramine. The nurse notes that the medication has not been taken by the client in 2 months. Which behavior observed in the client would validate noncompliance with this medication? 1. Complaints of insomnia. 2. Complaints of hunger and fatigue. 3. A pulse rate less than 60 beats per minute. 4. Frequent hand washing with hot, soapy water. Answer. 4. Frequent hand washing with hot, soapy water. Rationale. Clomipramine is a tricyclic antidepressant used to treat obsessive-compulsive disorder. Sedation sometimes occurs. Insomnia seldom is a side effect. Weight gain and tachycardia are side and adverse effects of this medication. 12. A client in preterm labor is being started on intravenous magnesium sulfate to stop the contractions. Several hours later, when the nurse is performing an assessment, the following data are obtained. Blood pressure, 110/66 of a millimeter Hg. Pulse, 66 beats per minute. Respirations, 10 breaths per minute. And deep tendon reflexes absent. What should the nurse do next? 1. Institute seizure precautions. 2. Prepare for a precipitous delivery. 3. Prepare to administer calcium gluconate as an antidote for magnesium toxicity. 4. Increase the rate of magnesium sulfate, as the desired outcome has not yet been achieved. Answer. 3. Prepare to administer calcium gluconate as an antidote for magnesium toxicity. Rationale. The antidote for magnesium sulfate is calcium gluconate. This medication should be available if the client experiences magnesium toxicity. The respiratory rate and absence of deep tendon reflexes indicate magnesium toxicity and not the need for an increase in the rate of the medication. The client is not exhibiting signs and symptoms of preeclampsia, which might necessitate seizure precautions. There are no data to indicate that this client is experiencing a precipitous labor. 13. The nurse is caring for a client in labor who is receiving oxytocin by intravenous infusion to stimulate uterine contractions. Which assessment finding should indicate to the nurse that the infusion needs to be discontinued? 1. Increased urinary output. 2. A fetal heart rate of 90 beats per minute. 3. 3 contractions occurring within a 10-minute period. 4. Adequate resting tone of the uterus palpated between contractions. Answer. 2. A fetal heart rate of 90 beats per minute. Rationale. A normal fetal heart rate is 110 to 160 beats per minute. Bradycardia or late or variable decelerations indicate fetal distress and the need to discontinue the oxytocin. Increased urinary output is unrelated to the use of oxytocin. The goal of labor augmentation is to achieve 3 good quality contractions, appropriate intensity and duration, in a 10-minute period. The uterus should return to resting tone between contractions. And there should be no evidence of fetal distress. 14. The nurse is reviewing the results of a test on a sample drawn from a child who is receiving carbamazepine for the control of seizures. The results indicate a serum carbamazepine level of 10 mcg per milliliter, 42.33 mmol/L. The nurse analyzes the results and anticipates that the primary healthcare provider, PHCP, will note which prescription? 1. Discontinuation of the medication. 2. A decreased dose of the medication. 3. an increased dose of the medication. 4. Continuation of the presently prescribed dosage. Answer. 4. Continuation of the presently prescribed dosage. Rationale. When carbamazepine is administered, blood levels need to be tested periodically to check for the child's absorption of the medication. The amount of the medication prescribed is based on the blood level achieved. Carbamazepine's therapeutic serum range is 6 to 12 mcg per milliliter, 34 to 51 mmol/L. Therefore, the nurse anticipates that the PHCP will continue the presently prescribed dosage. 15. Which statement made by a client taking montelukast indicates the need for further teaching? 1. I will need to have my liver function checked. 2. I can take the medication with food or without. 3. I may be able to decrease the use of my metered dose inhaler. 4. I will take the medication when I first notice I am having trouble breathing. Answer. 4. I will take the medication when I first notice I am having trouble breathing. Rationale. Montelukast cannot be used for quick relief of an asthma attack because effects of the medication develop too slowly. For prophylaxis and maintenance therapy of asthma, maximal effects develop within 24 hours of the first dose and are maintained with once daily dosing in the evening. The remaining options are correct statements. 16. Atorvastatin has been prescribed for a client. The nurse tells the client that which blood test will be done periodically while the client is taking this medication? 1. Neutrophil count. 2. Liver function studies. 3. White blood cell, WBC count. 4. Complete blood cell, CBC count. Answer. 2. Liver function studies. Rationale. Atorvastatin is a reductase inhibitor, HMG-CoA reductase inhibitor, that is used to treat hypercholesterolemia and hypertriglyceridemia. Because the medication is metabolized in the liver, baseline and periodic liver function tests, as well as cholesterol and triglyceride level determinations, should be done periodically. The tests identified in the remaining options are unrelated to the administration of HMG-CoA reductase inhibitors. 17. Insulin Lispro is prescribed for the client with diabetes mellitus, and the client is instructed to administer the insulin before meals. When should the nurse instruct the client to administer the insulin? 1. 45 minutes before eating. 2. 60 minutes before eating. 3. 90 minutes before eating. 4. Immediately before eating. Answer. 4. Immediately before eating. Rationale. Insulin Lispro acts more rapidly than regular insulin and has a shorter duration of action. The effect of insulin Lispro begins within 25 minutes after subcutaneous injection, peaks in 0.5 to 1.5 hours, and has a duration of action of approximately 5 hours. Because of its rapid onset, it can be administered from 15 minutes to immediately before eating. In contrast, regular insulin is generally administered 30 minutes before meals. 18. The nurse has administered a dose of meperidine hydrochloride to a client with renal colic as treatment for pain. The nurse carefully monitors this client for which side and adverse effect of this medication. 1. Bradycardia. 2. Hypertension. 3. Urinary retention. 4. Increased respirations. Answer. 3. Urinary retention. Rationale. Meperidine hydrochloride is an opioid analgesic. Side effects of meperidine hydrochloride include respiratory depression, orthostatic hypotension, tachycardia. drowsiness and mental clouding, constipation, and urinary retention. 19. The client with acquired immunodeficiency syndrome and Pneumocystis Jiroveci infection has been receiving pentamidine. The client develops a temperature of 101 F, 38.3 C. The nurse continues to assess the client, knowing that this sign most likely indicates which condition. 1. That the dose of the medication is too low. 2. That the client is experiencing toxic effects of the medication. 3. That the client has developed inadequacy of thermoregulation. 4. That the client has developed another infection caused by leukopenic effects of the medication. Answer. 4. That the client has developed another infection caused by leukopenic effects of the medication. Rationale. Acquired immunodeficiency syndrome is a viral disease caused by the human immunodeficiency virus, HIV, which destroys T cells, thereby increasing susceptibility to infection and malignancy. Pneumocystis jiroveci pneumonia, PCP, is a fungal infection and is a common opportunistic infection. Pentamidine is an antimicrobial used to treat PCP. Frequent side and adverse effects of this medication include leukopenia, thrombocytopenia, and anemia. The client should be monitored routinely for signs and symptoms of infection. The remaining options are inaccurate interpretations. 20. A client is diagnosed with herpes simplex virus type 1, HSV1. The primary healthcare provider prescribes a topical medication for treatment. The nurse anticipates that which medication will be prescribed. 1. Azelaic 2. Salicylic acid 3. Gentamicin sulfate 4. Mupirocin calcium. Answer. 1. Azelaic. Rationale. Azelaic is a topical antiviral agent that inhibits DNA replication in the virus. Azelaic has activity against herpes simplex virus types 1 and 2, varicella zoster virus, VZV, Epstein-Barr virus, EBV, and cytomegalovirus, CMV. Salicylic acid is a keratolytic. Gentamicin sulfate is an antibacterial agent and would not be effective in treating herpesvirus. Mupirocin calcium is a topical antibacterial agent that is active against Staphylococcus aureus, beta-hemolytic streptococci, and Streptococcus pyogenes. 21. A client who is scheduled to have warfarin sodium therapy has a prothrombin time, PT, of 28 seconds, 28 seconds. What is the most appropriate nursing intervention at this time? 1. Give double the dose. 2. Administer the next dose. 3. Give half of the next dose. 4. Call the primary healthcare provider, PHCP. Answer. 4. Call the primary healthcare provider, PHCP. Rationale. The PT is one test that may be used to monitor warfarin sodium therapy. The International Normalized Ratio is another laboratory test used to monitor warfarin therapy. The normal PT is 11 to 12.5 seconds, 11 to 12.5 seconds. A PT of 28 seconds represents an elevated value. The nurse should withhold the next dose and notify the PHCP. A medication dose should not be changed without a specific prescription, options 1 and 3. 22. A client with hypertension has begun taking spironolactone. The nurse teaches the client to limit intake of which food? 1. Rice 2. Salad 3. Oatmeal 4. Citrus fruits. Answer. 4. Citrus fruits. Rationale. Spironolactone is a potassium-retaining diuretic that causes hyperkalemia as the principal side or adverse effect. clients are instructed to restrict their intake of potassium-rich foods, such as citrus fruits and bananas. The other foods listed are appropriate to include in the diet. 23. Vasopressin is prescribed for a client with diabetes insipidus. The nurse should be particularly cautious in monitoring a client receiving this medication if the client has which pre-existing condition? 1. Depression. 2. Endometriosis. 3. Pheochromocytoma. 4. Coronary artery disease. Answer. 4. Coronary artery disease. Rationale. Because of its powerful vasoconstrictor actions, vasopressin can cause adverse cardiovascular effects. By constricting arteries of the heart, vasopressin can cause angina pectoris and even myocardial infarction, especially if administered to clients with coronary artery disease. In addition, vasopressin may cause vascular problems by decreasing blood flow in the periphery. The remaining options are not conditions of concern with the use of this medication. 24. The nurse has provided instructions to a client who will receive alteplase for the treatment of acute myocardial infarction. The nurse determines that teaching was effective if the client states that the main action of alteplase is what? 1. It will slow the clotting of my blood. 2. It will keep my blood thin to prevent clotting. 3. It will dissolve any clots that are obstructing the coronary arteries. 4. It will prevent any further clots from forming anywhere in the body. Answer. 3. It will dissolve any clots that are obstructing the coronary arteries. Rationale. Alteplase is a thrombolytic medication that is used to manage acute myocardial infarction. It lyses thrombi that are obstructing the coronary arteries, decreases infarct size, improves ventricular function, decreases the risk of heart failure, and limits the risk of death associated with myocardial infarction. Options 1, 2, and 4 are not actions of this medication. 25. The nurse is preparing to give a client directions for proper use of aluminum hydroxide tablets. Which instruction should the nurse provide to the client? 1. Take the tablet at the same time as an antacid. 2. Swallow the tablet whole with a full glass of water. 3. Take each dose with a laxative to prevent constipation. 4. Chew the tablet thoroughly and then drink 8 ounces of water. Answer. 4. Chew the tablet thoroughly and then drink 8 ounces of water. Rationale. Aluminum hydroxide tablets are an antacid and should be chewed thoroughly before swallowing to prevent them from entering the small intestine undissolved. An antacid should not be taken with the medication to prevent additive and interactive effects. Constipation is a side or adverse effect of the use of aluminum products. But the client should not take a laxative with each dose. This would promote laxative abuse and should be avoided if less habit-forming means can be used. 26. Terbutaline is prescribed for a client with bronchitis. The nurse checks the client's medical history for which disorder in which the medication should be used with caution. 1. Osteoarthritis. 2. Hypothyroidism. 3. Diabetes mellitus. 4. Polycystic disease. Answer. 3. Diabetes mellitus. Rationale. Terbutaline is a bronchodilator and is contraindicated in clients with hypersensitivity to sympathomimetics. It should be used with caution in clients with impaired cardiac function, diabetes mellitus, hypertension, hyperthyroidism, or a history of seizures. The medication may increase blood glucose levels. 27. Atorvastatin has been prescribed for a client, and the client asks the nurse about the action of the medication. How should the nurse respond? 1. It increases plasma cholesterol. 2. It increases plasma triglycerides. 3. It decreases low-density lipoproteins, LDLs. 4. It decreases high-density lipoproteins, HDLs. Answer. 3. It decreases low-density lipoproteins, LDLs. Rationale. Atorvastatin is a reductase inhibitor, HMG-CoA reductase inhibitor, that is used to treat hypercholesterolemia and hypertriglyceridemia. It decreases LDL cholesterol and plasma triglycerides and increases HDL cholesterol, the good cholesterol. The remaining options are not actions of this medication. 28. The client is given medication instructions for maintenance therapy for oral dantrolene sodium for the treatment of spasticity. Which client statement indicates understanding of the instructions? 1. I will take 50 milligrams once a day. 2. I will take 100 milligrams twice a day. 3. I will take 100 milligrams of this medication once a day. 4. I will take 200 milligrams of this medication 4 times a day. Answer. 2. I will take 100 milligrams twice a day. Rationale. For treatment of spasticity, dantrolene is administered orally. The initial dosage in adults is 25 milligrams once daily. The usual maintenance dosage is 100 milligrams 2 to 4 times daily. If beneficial effects do not develop within 45 days, dantrolene therapy should be discontinued. 29. The nurse is caring for a client with acquired immunodeficiency syndrome, AIDS, who is receiving didanosine. The nurse understands that side and adverse effects associated with this medication include which findings? Select all that apply. 1. Fatigue. 2. Diarrhea. 3. Pancreatitis. 4. Lactic acidosis. 5. Peripheral neuropathy. Answer. 2. Diarrhea. 3. Pancreatitis. 4. Lactic acidosis. 5. Peripheral neuropathy. Rationale. Acquired immunodeficiency syndrome is a viral disease caused by the human immunodeficiency virus, HIV, which destroys T cells, thereby increasing susceptibility to infection and malignancy. Human immunodeficiency virus, HIV, can cause acquired immunodeficiency syndrome, which is a viral disease that destroys T cells, thereby increasing susceptibility to infection and malignancy. Didanosine is a nucleoside-nucleotide reverse transcriptase inhibitor that is used to treat human immunodeficiency virus, HIV, infection. Side and adverse effects of this medication include diarrhea, pancreatitis, lactic acidosis, peripheral neuropathy, hepatic steatosis, chills or fever, and rash or pruritus. Fatigue can be a manifestation of AIDS but is not a side or adverse effect of this medication. 30. A pregnant client is receiving magnesium sulfate for the management of preeclampsia. The nurse determines that the client is experiencing toxicity from the medication if which findings are noted on assessment. Select all that apply. 1. Proteinuria of 3+2. Respirations of 10 breaths per minute. 3. Presence of deep tendon reflexes. 4. Urine output of 20 milliliters in an hour. 5. Serum magnesium level of 4 meq, L, 2 mmol, L. Answer. 2. Respirations of 10 breaths per minute. 4. Urine output of 20 milliliters in an hour. Rationale. Magnesium toxicity can occur from magnesium sulfate therapy. Signs of magnesium sulfate toxicity relate to the central nervous system depressant effects of the medication and include respiratory depression, loss of deep tendon reflexes, and a sudden decline in fetal heart rate and maternal heart rate and blood pressure. Respiratory rate below 12 breaths per minute is a sign of toxicity. Urine output should be at least 25 to 30 milliliters per hour. Proteinuria of 3 plus is an expected finding in a client with preeclampsia. Presence of deep tendon reflexes is a normal and expected finding. Therapeutic serum levels of magnesium are 4 to 7.5 meq/L, 2 to 3.75 mmol/L.